The spiral line wraps around the body in a spiral like the name says and connects all other planes of motion for balance. There is two spirals that make up the spiral line, the left side and the right side. The origin of the spiral line is the occipital ridge, and then it travels down and across the cervical spine to the medial border of the scapula, then runs along the lateral ribs down to the iliac crest and the anterior superior iliac spine, then down to the lateral tibial condyle, and then down and underneath to the base of the toe, and then back up to the fibular head, then to the ischial tuberosity, and then turns partially to the sacrum, and back up to the occipital ridge. There are two functions of the spiral line. First, to keep posture. For example, when walking down the stairs and then causing yourself to fall, the spiral line catches you to keep you standing. The second function is to allow rotational movement and to stabilize the torso and the leg. An exercise that influences the spiral line is the lunge with a twist. Other myofascial lines that are influenced are the arm lines, the lateral line, and both functional lines.
Okay. This is the shovel squat. Using the front and back functional lines, lateral line, and the arm line. Boom.
Another exercise that stretches the spiral line is the hanging abdominal twist. Another myofascial line that is also influential in this exercise is the lateral line.
Okay, so the functional front line is typically activated through exercises that involve contraction of the muscles along the front of the body. For example, serving a ball in tennis, a volleyball spike, or pitching a baseball, which Mike will demonstrate.
Throwing a baseball.
Yeah, there you go. And then for the functional back line, typically it is involved in contractions of the main mover muscles along the back of the body. Exercises and sports related activities that use the FBL include rowing a boat, doing a pull-up, or laying up a basketball, which Mike's going to do on a little mini basketball. In professional massage, the most practical release points for the front functional line would be the pectoralis major, the contralateral adductor magnus, and this is in athletes that overuse these muscles and have myofascial tension buildup. Main release points in the functional back line would include the lumbosacral fascial attachment of the latissimus dorsi and the iliotibial connection of the gluteus maximus into the lateral thigh, so right down there, and as well the vastus lateralis is a release point. The bony landmarks on the functional back line include the shaft of the humerus, the sacrum, the shaft of the femur, the patella, and the tuberosity of the tibia, so right below your patella. The bony landmarks for the functional front line include the shaft of the humerus, the 5th and 6th rib cartilage, so right up in there, the pubic tubercle and symphysis, so right down there, and the linea aspera of the femur. Perfect.